begins. Welcome to the Health Discourse Show, a weekly health talk show bringing you informed, practical, and engaging discussions on the issues that matter most to your well-being. From lifestyle diseases and cardiac health to nutrition, mental wellness, preventive care, and the everyday choices that shape healthy living. Here, we don't just talk about health. We break it down, ask the right questions, and give you knowledge that you can actually use. Because good health starts with understanding, and healing begins with conversation. Tune in to the Health Discourse Show with your host, Asasha Elizabeth, every Monday from 9:30 a.m. to 10:30 a.m. for informed conversations that heal. A very warm good morning and welcome to the Health Discourse Show, your trusted space for conversations that empower and inform to help us make better choices about our health. I'm Asasha Elizabeth, coming to you live from our Capuchin television studio in Karen. Now today we shine a spotlight on a condition that affects millions of people across the world, yet many live with it without even knowing. High blood pressure, sometimes referred to as a silent killer, quote unquote. It quietly damages vital organs such as the heart, the kidneys, and the brain. And in many cases, the first sign can be a life-threatening emergency such as a stroke or heart attack. So how do we detect it early, and who is most at risk, and what simple lifestyle chances or changes can help prevent or control it? To help us unpack this critical condition, I'm joined by Dr. Stephen Thigu, who is an internal medicine specialist from Mater Misericordia Hospital. Welcome to the Health Discourse, Doctor.
Thank you, Elizabeth.
Before we get into the conversation, kindly tell us briefly about your area of specialization and the kind of conditions that you mainly deal with as an internal medicine specialist.
Yes, thank you, Elizabeth. Viewers, as you've been informed, my name is Dr. Stephen Thigu. An internal medicine physician. So basically what physicians do, we treat adults for conditions that require drugs. So we work with surgeons who will treat conditions that will require operative procedures, but we treat you with drugs for conditions that require drugs. And this will range from heart conditions, from kidney diseases, from infectious diseases, things like HIV and TB, from strokes, diseases that affect the brain, diseases that affect joints and muscles. So basically we are to what children have as pediatricians. We are now the doctors that treat adults. Yes.
Thank you very much for making time for this conversation. And of course, we give you an opportunity as our viewer to weigh in on the conversation. Any comments, any feedback, any question that you have regarding high blood pressure, this silent killer, feel free to drop your comments on our social media platforms as well as on the numbers appearing on your screen. And without wasting time, let's begin, Dr. Thigu, with the foundation. What exactly is high blood pressure, and why has it earned this troubling nickname, the silent killer?
Yeah, so thank you for that question, Elizabeth. So high blood pressure, just you could unpack it from the three words. So the pressure that is circulating in your vessels that is higher than what is expected. And basically what we say is this: the standard pressure, what is at rest, should be 120/80 or lower than that. And these are two numbers. I'll unpack them slowly for you. And when your heart pumps blood, that force generates the first number. We call it the systolic pressure. And then after the heart has pumped, when the heart is relaxing, if I put it that way, when the heart is not pumping, there is a force that is exerted by the arteries. We call them vessels in the medical terminology, but those are the pipes that carry blood from the heart. That force that is exerted by the arteries, or the force that is generated from the arteries when the heart is relaxing, we call it diastolic pressure. So high blood pressure is a condition whereby the force that the heart is pumping with and the resistance that is generated by the arteries is above 120/80 for adults. And we measure that with small machines. It's done in the clinic, one that can be tied around your forearm, and it will record the pressures for you. Now, I want to also just clarify that term high blood pressure to say that the body doesn't maintain a static pressure, that you're 120/80 all the time. This pressure is pressure that is measured at rest. You come in, you've rested about 5-10 minutes, and your pressure is recorded. Because, of course, as you exert yourself in activity, if you're exercising, you're running, your pressure will go up to keep up with the body's demands. But this pressure we are talking about is a pressure that is recorded after you've taken some minutes to rest. Yes.
Thank you very much. And what is the prevalence rate of high blood pressure, let's say in Kenya or even globally?
Yes. So high blood pressure is a very common condition. And it's very common in the sense that we are 3 of us here in the studio, and chances are one of us has high blood pressure.
But we don't even know it.
Exactly. So 1 in 3 people above the age of 40 has high blood pressure. But in our setting, we have only diagnosed about 30% of the population. Why? Because majority of the people will not check. If you go a bit deeper and check in the world, high blood pressure is taking out about 10 million people every year. And back to the question you asked earlier, why is it called a silent killer? Because most times your pressure will be high, you won't know it. Some people are expecting that, oh, I'll get a headache, I'll see some blurry vision. By the time you are experiencing those symptoms, you've already probably lived with high blood pressure for much longer, and you're now seeing complications of the pressure. So it's called a silent killer because you may live with it without knowing it. And majority of the cases, that is the situation. So approximately 33% of the population above the age of 40 will have high blood pressure, and it's taking out about 10 million people every year. So it's a pretty serious illness if you think about it in that sense.
More often when one checks their blood pressure at the triage, which is usually the very first step before even you get to consultation, they usually see 2 numbers. Could you break down what these 2 numbers represent and what they reveal about our cardiovascular health?
Yes, so thank you. Just go back to what I'd said earlier. When we measure pressure, yes, it gives you the 2 numbers. The upper number is called systolic pressure, and the lower number is called diastolic pressure. It's called systolic because it's the force that is generated by the heart. Think of the heart as a pump, like the pump that pumps water in our houses. So that first force that is generated by that pump.
Fuel.
Yes, or even the fuel pump. When you go to a petrol station, that's a good analogy. I like that. Yes, so that force is the first pressure. But remember, this force is passing through a system, and the system is now the circulatory system, that is the arteries and the veins. So when that force passes through the arteries also exert a certain force to absorb that force, and we call that diastolic. So when the heart is relaxing, you have that lower number that is called the diastolic pressure. Both very important because the first pressure can burst the vessels, but during the time of relaxing is also when the heart receives its blood supply, the diastolic pressure. Yes.
Thank you. And high blood pressure, we understand that does not develop overnight. What are there some of the most common risk factors that increase someone's chances of developing high blood pressure?
Yes. Thank you again. So high blood pressure will be gradual. You notice when I was giving statistics, I was talking about the age of 40 and above. Because if you look at the general population, as we grow older, also the same way our muscles become weaker, our bones start to ache a bit, also our vascular system tends to grow older. So you'll find that the pressure will set in slowly over time for majority of the people. There are people who have other causes of pressure that will make the pressure come in suddenly. And we'll probably, I don't know whether we'll get a chance, we can talk about that. But in terms of the question you asked about risk factors, age is one of them. So as we grow older, chances of us having high pressures increase. Number 2 is genetics. So there are people who come from families where they're generally predisposed to having high blood pressure. And how to break it down is, if your parent is hypertensive, you have siblings who are hypertension, by the way, is also high blood pressure, who have hypertension. You have relatives who have, chances are that you are at risk genetically. Number 3 is lifestyle. And among the lifestyle issues is diet. So we live at a time where we are consuming a lot of sugar and carbohydrates, and we are very sedentary. We don't work. We are no longer like our great-grandfathers who used to roam and work. A lot of our diet is sugar and salt. So those two things, sugar, salt, they are some of the things that will predispose you in terms of diet. But now there is also the sedentariness, activity. We are not exercising as much as we used to. That predisposes us to high blood pressure. Then smoking. I want to keep insisting on smoking because it's one of the modifiable risk factors. And then alcohol. So alcohol, we say that it has to be moderated. If you're going to consume, we have to moderate the alcohol consumption. So those are among the common risk factors. Oh, and being a man as well is a risk factor.
Oh, sure. How so?
Yes.
So that means that demographically, men are more predisposed to hypertension than women.
Exactly. Yes.
How so?
Yes. Being male is a risk factor for developing high blood pressure. Yes. So when now you come down, so some of those you'll notice there are things you cannot change about yourself. You cannot change the fact that you're a man, the fact that you're growing older, and the fact that you're born in a certain family. So genetics. So we say those are non-modifiable risk factors. But you can change your diet. You can change your activity in terms of exercise. Are you going to exercise or not? You can choose not to smoke. You can choose to moderate your alcohol consumption. So we call those modifiable risk factors. They are things that you can change about yourself. Yes.
But what is the rationale behind men being more at risk of high blood pressure than women?
Yes, so that's a good question, and maybe, I don't know whether it falls within our scope, but I'll answer it in a simple way. It goes down to hormones, okay? So over time, it's been shown that the effect of estrogen in ladies, it tends to help them over time to keep their pressures a bit lower than men. Okay, so that's one of the standard one that is known outside. So you say they are doing the same level of activity, they are eating the same food, they are doing similar things. So their hormonal makeup, female hormonal makeup, is a little bit protective compared to a man. But the other things that you would add to that is now you can't interpret that in isolation. When you look in our population, who is likely to be found smoking between men and women?
Likely men,
Who is likely to be found consuming alcohol? Men and women. Who is likely to be eating out a lot of nyama choma with a lot of salt between men and women? So you notice now there are other modifiable risk factors that men have that compound it to their build or their hormonal, or their profile that increases the risk for them. Yes.
Okay, great. And of course, as you mentioned, some of these factors, there are those that one can realistically control, and there are those that one cannot. Things like genetics, like age, you can't like block age. As you grow old, you just have to grow old. So are there the ones that you would advise that someone can look out for to ensure that they stay safer from hypertension?
Yes. So as I've just stated a bit earlier about separating the risk factors between what you can change and what you can't change. But I also want to mention that I've only narrowed myself to one type of high blood pressure that we call primary, like the one that has not gone to high school. We call it essential hypertension, where we know the risk factors. There is also a type of high blood pressure, we call it secondary hypertension, or high blood pressure with other diseases that can be treated and reversed. And so outside the things that you can change about your lifestyle, your activity, your diet, now the reason why you go to hospital and to see the doctor is so that he can also help you to identify whether you have secondary hypertension. And in secondary hypertension, secondary high blood pressure, you have things you can change. For example, if your thyroid gland that is positioned around the neck, I remember 5 years ago we did a talk on the thyroid gland.
Yes.
So if your thyroid gland has an illness, that can be treated and it can resolve your high blood pressure because hyperthyroidism is one of the causes of secondary hypertension. There is another small gland that sits near the kidney called the adrenal gland. If you have a problem with the adrenal gland, even a cancer of that gland, your pressures can go high So you see a doctor again to help you identify whether you have primary hyperadrenalism, the adrenal gland acting too much and driving the pressure. The kidneys. If you have kidney illnesses, something we call parenchymal kidney diseases, those can predispose you or can cause you to have high blood pressure because the kidney is the safety valve. When the pressure is too high, the kidney is the one that is easing the pressure in the system. Again, that is a modifiable risk factors. Stress hormones, and stress, by the way, is a modifiable risk factor. If you have too much persistent stress over time, not the small stress that you get anxiety and it's over. If you are living in a chronic stressful environment, again, that is a modifiable risk factor. And some people that develops into a disease we call Cushing's syndrome, which is driven primarily by excesses of cortisol. So there are other causes, we call secondary causes of hypertension, that are ruled out or that are eliminated as the doctor is assessing you and running tests. Yes.
Well, before we get back again to the factors, you mentioned the stress, and in our daily lives right now, where we live at a times when stress can be most of the time unavoidable in today's fast-paced world. And what is exactly the link between stress and high blood pressure? And can managing this actually help to reduce the risk of high blood pressure?
Yes, so stress response by our bodies was not entirely a bad thing, okay? We talk of, maybe you've heard the concept called fight or flight. When you're faced by danger, when you see a lion approaching you, you need energy to be able to run away or to fight the lion, okay? So your heart beats very fast, you sweat a little bit, and you wonder even, you can jump over a wall. So what is driving you there? It's part of the hormones that are released during that acute stressful episode. So stress in those small doses is not a bad thing because the body was created that way to be able to respond when faced with danger. So when you
adrenaline rush.
Yes, exactly. yes. Actually, you nailed it. It's the adrenaline. So that adrenaline in itself, one of its action is to increase your heart rate and to narrow your blood vessels, basically to increase your pressure so that you're able to supply oxygen and blood to even your legs, your hands, your brain, your eyes. You suddenly can
run
see
for your life.
To run for your life. Exactly. But now, if you're living in chronic stress, that you're constantly not getting enough hours of sleep, you're spending hours and hours on traffic, you come to work, it's anxiety, that over time, the body slowly transitions, outside just driving you with adrenaline, another hormone kicks in. It's called cortisol. Okay? So this cortisol plays a big part in keeping your pressures high. And the big part of this is as well that besides just putting the pressure high, it will affect many other aspects of your body. Because remember, you not only need the blood to circulate, you need sugar. So it will force you to retain more sugar. So it is slowly pushing you to a diabetic state. It will force you to distribute fat disproportionately, because it's saying, hey, danger is coming. So you suddenly find you are getting a tummy, you are getting a bull neck. So chronic stressful conditions, that's in a simplistic way how they drive pressure in our setting. Yes.
High blood pressure, most of the people always maybe downplay it or feel like they do not see the seriousness, perhaps because it does not exhibit symptoms or early symptoms like other health conditions do. But still, it is dangerous. Someone might be having their high blood pressures skyrocketing, but they are not aware. What can it lead to over time?
Yes, so we call it a silent killer because most times you won't feel it, you won't know that you have it unless you go and get checked. So I want to also mention that it's very simple. It will only take you less than 2 minutes to know what your pressure is. And imagine such a killer that's taking almost 30% of deaths that we see are directly or indirectly contributed by pressure. Imagine how easy it is to diagnose it. Yet most of us don't know that we have it. The reason is that most times we rely on what we feel. The body speaks to you in very simple languages. Headache, a cough, if it's a pneumonia, joint pains. But pressure is not like that. It has developed slowly over time, and majority of the time, people will have no symptoms. By the time the symptoms are developing, perhaps the pressure is too high. And most people will think that, I'll wait until I have a headache, I'll wait until I hear ringing noise in my ears, or I see my vision is a bit blurry, or I feel my heart pounding on my chest, or I see my legs swelling. By the time you're developing those symptoms, you're already developing complications of the pressure. So my advice to all of us is that it's a very simple thing to diagnose. You walk into a chemist now, if they charge you a lot, it will be 50 bob. Most times they don't charge. You go to church when they're screening, 2 minutes, your pressure is checked. You know if it's high, if it's not. But if you're waiting to rely on symptoms, then most likely you might be coming into that statistics of the silent deaths or silent complications as a result of the pressure. Yes.
And in terms of the age brackets, do we have high blood pressure affecting the younger population, including children, or just the older people?
Yes, so we are seeing a certain shift in terms of what we used to know, say 5-10 years ago. People will argue that high blood pressure is a disease of people above the age of 40, but over time, I've seen in the clinic people as young as 20s, even young children, coming in with high blood pressure. Remember when I talked earlier, I've mentioned that you have primary hypertension, that is because you're a man, you're growing older, you smoke, but you also have secondary hypertension that is driven by other organ dysfunctions. So yes, it's possible to have pressure in the young, people below the age of 20, and most times when you see those people, you take a lot of time to look for secondary causes, to find an underlying cause that can be treated and maybe the pressure resolves. But our demographics have shifted so that what we used to say would be diseases of people above the age of 40, we encourage everyone above the age of 25 to at least screen your blood pressure. Just walk in and check your pressure. If you're told your pressure is okay and you're below the age of 40, you can do that after 2 years. If you're above the age of 40, you're encouraged to do the screening every year. If you go and you're told that your pressure is high, you're now encouraged to go and monitor your pressures away from the clinic at home, because there is another small concept I want to just introduce a bit called white coat hypertension. Remember you said stress can cause you to have high blood pressure. There are some people when you come and you see the doctor with the white coat and all those things, your pressure goes up. So because of that, we encourage you to go back home, to go to a safe place and monitor and record. And if your pressure was picked to be high in the first one, you're probably given a review date within a month so that we see the trend. So the disease can affect the entire population. It tends to be skewed towards older people because their blood vessels are growing older, their risk factors are increasing with age, but it can affect across spectrum. So what I would say to the viewers is that at least once in your life, have your pressure checked, be told if it's okay or if it's not. If you're above the age of 40, make it a habit of having your pressure checked every year. Yes.
Now, still on the same strain, what do we attribute this shift to? Because conventionally, the high blood pressure is just associated, as you said, with the older generation, 40 and above. But right now, there's a shift. We are seeing even young children, you know, the youth who are also suffering from this silent killer.
Yes, so recently we did Kenya Demographic Health Survey. Basically, it's a national-wide survey that looks at diseases and risk factors, and we've noticed a strange thing. In the 90s, people will die more of things that we call infectious conditions, okay? Communicable diseases, so things like pneumonia, TB, HIV, those things would kill a lot of people. But as years have gone, as medical therapies have improved, people are now living longer, okay? So that's one of the things that's happening. People are living longer. But at the same time, now you find the non-communicable diseases where high blood pressure is one of them, and its close cousin diabetes is another one. Those ones now are taking their own share. So those advances have come at a cost, because as our mobility improves, as we get borders from every point to the next, it means people are not exercising as much as they used to. As we eat a lot of processed food, A lot of our food has a lot of salt. The sausages that we eat, everything has salt in it. Again, as we are taking a lot of those processed food, our risk factors are increasing. As we are becoming more sedentary, we sit in offices, our risk factors are increasing. Okay, so as our population slowly becomes urbanized, if I use that word, we have a lot of conveniences. That indirectly is contributing to the increase in our risk factors and in us now seeing high blood pressure in younger people. I want to say that is not just unique to high blood pressure. It's also seen in diabetes. It's also seen in obesity, where you have, your body fat constitution is too high. We are seeing that also in younger and younger populations. So yes, the contribution is our lifestyle, our diet, our activity levels, and the chronic stress that we have.
Thank you. And for expectant mothers, we've noticed that they also are at a high risk of high blood pressure or hypertension. And in some cases, they've had to be hospitalized to have the pressure monitored, or even in the worst case scenario, they are rushed for emergency C-section to remove the baby. So is it the same? Like, do the symptoms remain silent or do not manifest outwardly in expectant women as well?
Yes, so remember I mentioned that hormones play a part in how pressure is regulated in the body. So the type of pressure you get in pregnant women, it can be a pregnant woman who has been having high blood pressure in the past, and then now it's just showing up in pregnancy. Okay, so they have primary high blood pressure, primary hypertension, but now in pregnancy it's showing up more. Okay, it can be pressure that develops during pregnancy that we call gestational hypertension. Okay, and then it can be pressure that goes too high, we call it preeclampsia. Okay, so you'll notice it's not one disease, but the manifestation is the same. You're seeing pressure that is high. So preeclampsia and gestational hypertension, it's again something you can see in young people. Someone may be just as young as 18, 20, 22, and in their first pregnancy, they are told your pressure is too high. So that pressure is driven by a different thing. And studies have shown that pressure is driven by some factors within the placenta. The placenta is the organ that feeds the baby, okay? And as the placenta is forming and developing in the course of the pregnancy, the pressure will keep going high. So the women that you described who get hospitalized because of high blood pressure in pregnancy, most likely they have that type of pressure that we call preeclampsia. It's very dangerous because unless if you're not able to control it with drugs to allow the baby to grow to some point, unless you deliver the baby, so to answer the question of the C-section, unless you deliver that baby at that point, that pressure is likely to continue going high. It will affect other organs like the brain, the liver, and it can lead to death. So it can lead to convulsions and death. So that's why you find sometimes when pressure is peaked in pregnancy, this person is hospitalized, he's monitored around the clock, is regulated, and at that point the doctors are making a decision. They are balancing. Can we allow the baby to develop long enough before we get the baby out? Because if you get the baby out and the placenta, the pressure is likely to settle over time. Okay, yeah. So that's why you see those emergency sections. So again, it becomes a different subset of illness. The good thing in our country is that we encourage everybody, every pregnant lady, the moment you know that you're pregnant or even suspect you're pregnant, start your antenatal clinics early. Because in each and every visit, your blood pressure is checked, 2 minutes. Someone is able to check even without symptoms, and they're able to treat you.
Okay. Yes. Thank you very much. This is quite interesting, but it's time to take a breather. We will be right back with more on high blood pressure, the silent killer among us.
In a world where health information is everywhere, but clarity is rare, there's a place where understanding begins. Welcome to the Health Discourse Show, a weekly health talk show bringing you informed, practical, and engaging discussions on the issues that matter most to your well-being. From lifestyle diseases and cardiac health to nutrition, mental wellness, preventive care, and the everyday choices that shape healthy living. Here, we don't just talk about health. We break it down, ask the right questions, and give you knowledge that you can actually use. Because good health starts with understanding, and healing begins with conversation. Tune in to the Health Discourse Show with your host Asasha Elizabeth every Monday from 9:30 a.m. to 10:30 a.m. for informed conversations that heal.
Misericordia Hospital. Healing meets innovation. With advanced laparoscopic surgery, we offer patients a faster and safer path to recovery.
We do very small incisions using what we call keyhole surgery, and we introduce cameras into very small spaces and small holes that we also do, and introduce small gadgets that are able to do different kind of surgeries.
From gallbladder removal to infertility treatments and endometriosis care, our specialists treat conditions that once required open surgery.
Being able to currently do minimally invasive procedures that assure a patient of reduced length of stay in the hospital, reduced complications likelihood, that has been supported by the current infrastructure that we've set up in the hospital.
Mater Misericordia Hospital. Excellence in care every step of the way.
Christianity. In everything, do to others as you would have them do to you, for this is the law and prophets. Islam. No one of you truly believes until you wish for others what you wish for yourself. Judaism. What is hateful to you, do not do to your neighbor. This is the whole Torah. All the rest is commentary. Baha'i faith. Lay not on any soul a load that you would not wish to be laid upon you, and desire not for anyone the things you would not desire for yourself. Buddhism. Treat not others in ways that you yourself would find hurtful. Hinduism. This is the sum of duty. Do not do to others what would cause pain if done to you.
In a world where health information is everywhere, but clarity is rare, there's a place where understanding begins. Welcome to the Health Discourse Show, a weekly health talk show bringing you informed, practical, and engaging discussions on the issues that matter most to your well-being. From lifestyle diseases and cardiac health to nutrition, mental wellness, preventive care, and the everyday choices that shape healthy living. Here, we don't just talk about health. We break it down, ask the right questions, and give you knowledge that you can actually use. Because good health starts with understanding, and healing begins with conversation. Tune in to the Health Discourse Show with your host Asasha Elizabeth every Monday from 9:30 a.m. to 10:30 a.m. for informed conversations that heal.
Well, welcome back. This is the Health Discourse Show. This is our second session of the conversation on high blood pressure or hypertension, commonly referred to as the silent killer. And of course, with me in studio is Dr. Stephen Thigu, who is an internal medicine physician. And of course, we continue the conversation. We pick it up from where we left it. Welcome back to this second session, Dr. Thigu.
Thank you.
It's quite interesting how high blood pressure, sometimes most of these diseases, the one that seems to be very dangerous, people don't feel how dangerous they are, perhaps because they feel at one point someone may be very alive and very strong and kicking, the next minute they are critically ill. Let's continue with our conversation. For individuals with a family history of hypertension, sometimes risk can feel somehow inevitable. Is high blood pressure really preventable, or can these people from a family that a history of high BP, is there anything they can do to ensure that they protect their health or they stay safe from it, or once you come from that history, it means that is your ticket to having this condition?
Thank you for that question. And as I respond to it, allow me to just mention numbers. And why numbers are important, because even this pressure is measured in numbers. Yes, so we said that the pressure has two readings, the systolic and the diastolic. So I talked about a number 120/80. So nowadays we say a pressure below 120/80 is optimal. So we all want to have optimum performance. Yes, so if your pressure readings are below 120/80, you're optimal, okay? Then we have what we'd still consider normal, okay? If your readings are between 120 to 129, 80 to 84, that is normal. But it's not considered optimal, but it's normal. Okay, then we have a higher normal, that the lower one goes from 84 to 89. But with the most recent guidelines now, any pressures above 130, we're considering that high blood pressure for the systolic, and the pressures above 89, that is 90 and above, is high blood pressure. So from there, then we continue going on. We have high blood pressure stage 1, stage 2, emergencies. So by the time your pressures are all the way up above 160s, above 180, those ones, even when we measure it at triage, we tell you we can't let you go home. We have to admit you, because basically it means anything could happen to you if it has not already happened. Because some people will come with a pressure of above 160 and they already have stroke. So those numbers are important, and I think it's very important for our viewers to keep in mind, because now if you have a family history, the question that you asked, you already know I'm genetically predisposed. Both my parents have had high blood pressure from the time I've known myself. I look around, my uncles and siblings have had high blood pressure. You want to keep your eye on the numbers as you screen. You want to try as much as possible to be in the normal or in the optimal group, okay? So if you have a family history, you remember the modifiable risk factors we talked about. This applies across board. The person with the family history, the person without. Are you smoking? Stop. Do you exercise? By exercise, by the way, we mean a minimum of 30 minutes, about 5 times a week of aerobic exercise that pushes your heart rate up. And if I try to call you on the phone, it will be hard to have a conversation because unahema, you're panting. So do you exercise? Are you eating healthy? Meaning diets low in salt. Remember, I've not said no salt, I've just said low salt. And then low carbohydrate diet. Are you doing that? And then are you obese? Are you overweight? Because that's a risk factor. Obesity is a risk factor. And it's one of those modifiable risk factors. So then have you been checked? Have you been screened? Because there are people now we know they have high blood pressure because their bodies cannot handle cholesterol very well. Cholesterol is that fat that when it's deposited along the arteries, it hardens the arteries and predisposes you to high blood pressure. So with someone who has family history, I would encourage the screening earlier, and if possible, a complete wellness checkup where your cholesterol levels are checked, your kidney function is checked, your kidney function is checked, your cholesterol is checked, and your uric acid. Those are the things that could be predisposing members of your family to high blood pressure as you continue to implement the lifestyle changes. Now, if you're caught in any of the numbers, you're told, okay, today we measured, it's above 130 over 90, maybe it was white coat, go home, monitor for a month, come with the readings we see. Yes, we notice even when you're taking it from home, it's still high, and it's time to start medicine. The treatment, when you're treating high blood pressure, it's a treatment to prevent. And what I mean is it's a treatment to prevent the complications that come with high blood pressure. Because what will kill people with high blood pressure will be things like stroke. They can easily get blindness, they can get heart attack, they can get kidney disease. So the treatment you get is also a form of prevention.
You've mentioned lifestyle choices as a key part of managing blood pressure. From diet to daily habits, are there those that you consider more effective to make a bigger difference, and the ones that are less effective, or a combination of all these?
Yes, so any small investment you put in your health, either it's diet, it's exercise, it's stopping smoking, it has a return. I like to tell my patients that if today all you chose to do is come up a flight of stairs instead of the lift, imagine you've earned yourself some capital in your wellness, okay? So any small investment you put in your health, if you are a smoker, you stopped, that is a benefit to you. But in terms of now narrowing down to the specifics, I don't know, I think this may be new to our viewers. Did you know that if you're overweight, and we have scales that we use to measure the obesity, if you have a BMI above 25, we say you're overweight, a body mass index, and maybe that we'll discuss another day. But if you've been told that you're overweight or you're obese, did you know that if you lost 5 to 10% of your weight, meaning if you are 80 kilos today, you went and lost 4 kilos to 8 kilos of your weight, it has a bearing in lowering your blood pressure. It can reduce your blood pressure between 5 and 8 units. So meaning, if you say, for example, it's good to just give with an analogy, an example. If today you came, your blood pressure was 128/89, and I told you, hey, this is moving up. But you're also obese, you're 10, 15 kilos above, you're 80 kilos and you're obese. Then you go, in the 2 months you exercise, you work out, you reduce your weight, you get to 80 kgs. I can guarantee you by the time you come back, your blood pressure will be 5 to 8 units. It was 128, it will be 124 systolic, and the diastolic will be below 89, it will be 84, 85. So investment in your health, any small investment is worthwhile. Now, from a medical perspective, we further define it, okay? So we say that if you reduce the calorie intake, and these are sugary things, bread, ugali, rice, cakes, all those things, they contribute to giving you calories that sometimes you don't need. If you reduce that, it has a bearing on your weight. If you did cardiovascular exercise like brisk walking, swimming, jogging, those things that push your heart rate, if you did about 150 minutes, that's 30 minutes 5 times a week. If you did that, again, it has a big bearing in improving your cardiovascular health. And at this point, I also want to just comment and say that if any of you who is watching is an athlete or you've interacted with athletes, you'll notice that their pressures are low and their heart rates are low, and the body is basically able to meet its needs without pushing the pressure up. So what I've seen most effective, diet, exercise, stopping smoking, and managing stress. Those are things you'll start to see results almost immediately. Yes.
And once this person now is presenting HBP, what are the available treatment or management modalities? Is it something that they can be treated and then given a clean bill of health, or is something that can just be managed over time?
Yes, so what we are doing now in hypertension, besides just chasing the number, basically pursuing the 120/80, we are treating to prevent complications or to prevent the progression of the complications. So here's what I mean. When you come to see a doctor and he makes a diagnosis of high blood pressure, by the way, it's not made one of, unless it's very high, unless you are coming with blood pressures 150, 160, above 90, at that point you say, this one, it can't be white coat hypertension. But someone comes and you make a diagnosis of high blood pressure. As you start to treat them, you are treating them so that you can prevent progression of, you can prevent stroke, you can prevent heart attack, you can prevent kidney failure, you can protect their vision, okay? So, the medications that will be chosen for you say you're the one who came, and say, for example, for someone else who came, might be very different. So it's not one shoe fits all. Okay, just because of the complication profile. Secondly, remember I said high blood pressure is not just one disease. We also have secondary hypertension that is caused by all the other things. So the treatment for someone with secondary hypertension, depending on what is driving the hypertension, will be again different. So you can't call your mom and say, oh, what my mom takes is this and it works for her, it will also work for me. Your treatment is tailored to you. And it's tailored, one, to reduce or to prevent complications, and two, to have the minimum side effects for the person. Yes.
Oh, great. And we'll get back to that mom uses this, so I think it can also work out for me. But first, many patients start medication, but once they feel a little bit better, they feel, okay, I'm good now, I can let go. What would you tell them? What would be your advice to people who are tempted to discontinue their blood pressure medication without medical guidance?
Yes, thank you for that question. That's a very common experience. And I just want to share a story about one of my patients that I saw not long ago, about 2 or 3 months back. And I'm sharing this because it's a sad story, but I also feel people will remember better. So it's a gentleman in his late 90s, probably towards 100, very fit, very sharp. He's invested over the years. You know, he even lives alone, or he used to live alone up country. He's able to care for himself. He was able to drive around. And he had been on treatment for high blood pressure for many years, for more than 20 years, because it was diagnosed in his 50s. And this is someone headed to their hundreds. So over time, I think the advice of relatives and children, some, you know, they have many children, everyone has advice. You know, you go, you watch this, you come and say, no, yeah, this one comes and do this.
The self-proclaimed doctors, eh?
Exactly, yes. So over time, I think the advice prevailed, like, you know, why do you keep taking all this medication this time? Remember, throughout his working life and even the years preceding, very prompt in his clinic reviews. He's seen, he's told, let me see you every 6 months, sometimes let me see you once a year. But the advice, you know, people come, the advice tell you, you know, daddy, you have to keep taking all these drugs. Anyway, long and short is that he discontinued medication, okay? And not everyone knew that he had discontinued, but some of the children played a part in that. Sadly, the time I saw this gentleman, he came in with a stroke, okay? And the first thing was shock, because this is someone who's been on follow-up with a cardiologist. All his markers and everything had been done. His medication is optimized. And it's only in the hospitalization week that we learned, oh, the gentleman had stopped medication almost a month before. You can imagine now the tension it brings in the family. You are the people who told him to stop. You are the ones who did this. You are the ones who are doing this on diet. So these complications are real. And when we are starting you on treatment for high blood pressure, yes, there is a subset of people that will come, and this is about 10% of the population that you are treating for high blood pressure will come. They'll employ the dietary changes, they'll be active, and maybe they're able to lower their pressure to a threshold that needs to stop medication. But this is a decision that has to be made in consultation with your doctor to say, okay, now I think you're doing well, let's try with one drug and see. I think let's do 3 months and follow you up. The thing is, even after you stop, you are told and encouraged to continue monitoring at least once every 6 months, or even buy the blood pressure machine. It's only about 3,000 to 5,000 bob. Keep it at home and be monitoring your pressures at home. So I've seen many of the stories like of that gentleman that I've mentioned. Many more that people come, they were on their pressure medicine, because remember, it's a silent killer. You are not feeling anything, you didn't have any symptoms. Over time, the inertia checks in. Basically, you get tired of taking this pill every day. Then you say, let me go off the drug. Unfortunately, the end is usually not so good when you stop the medication. So my advice is that treatment for high blood pressure is long-term. I know when we say long-term, people say, will I take it for life? I don't like to say for life, because we don't know what will be discovered in the next 10 years. Maybe some people will discover an injection that you get once a year and you don't have to take drugs. But when you're starting treatment, it's long-term. Then it's titrated and individualized. That what you take is not what the other person takes. It's individualized
And it
you.
also narrows down to the type of HBP, right?
Exactly, that you have.
That you have.
Yes. So I advise that it is not wise at all to discontinue your medication. If you have issues with the medication side effects, sit with your doctor, because we have so many drugs we can choose from that we can individualize the therapy to you. Yes.
Thank you very much, Dr. Thigu. Now, we are living in the information age, and I think this somehow is I think a double-edged sword. There's a positive about it and a negative about it. Some of this was presented or evident during the COVID-19 pandemic, when we had even the infodemic, the pandemic and the infodemic, the outbreak of information of which you cannot fact check and see what is it that is truthful, what is it that is correct, what is just a conspiracy theory and all that. We have abundance of health information online. Many people are increasingly self-medicating and, of course, experimenting with herbals and over-the-counter medications or remedies to control blood pressure. What are the potential dangers of this approach?
Yes, thank you. That's something that we grapple with every day in the clinic. Yes, and I think the information age that we are in, the artificial intelligence and the other things, they are here to stay. So we have to embrace that. But
Dr. Google.
Yes, now it's even
now Dr. AI, Dr. Chat GPT.
Exactly. So these things are here to stay with us, but those things don't replace the space of professional guidance and advice. Because a lot of what people will do, people will even make an AI-generated video and tell you, and you'll think it's reality. Because most of some of the things that are put up there, they are not subjected to the rigorousness of research. Like, it's not things that are verifiable and things that you can count on. So what I like to do is to encourage my patients. The information you have, share it with your doctor. And most doctors these days will be very receptive to listen to you, and they will work with you in that part. Because remember, we said this is a lifestyle disease. So perhaps the herb that you're taking, the cinnamon, is helping you helping you to sleep better. So if you're sleeping better, your stress levels are going down, and your pressure is settling. So the cinnamon is driving the stress, but it's also helping you to rest a little better than you did. The person who is taking garlic there, maybe it's making you feel more satisfied or fuller for longer. So you don't have to keep craving this, the mandazis and the other sugary things. Again, it's contributing to your diet and to your lifestyle. So about herbs and dietary changes, I encourage the person to discuss it with the care provider and be very honest and open about it. Most of us now, we are comfortable and we embrace that discussion so that you can make an informed decision. Now, about the over-the-counter medication for hypertension. First of all, hypertension medicine is prescription medicine. Yeah, if you were to follow the law to the letter, it should be drugs that are only given to you with a prescription. The dangers of just taking drugs over the counter is you may miss out on a probable secondary cause of the high blood pressure. And majority of the times, if I didn't mention earlier, is that for secondary hypertension, let's say, for example, your hypertension is driven by some growth or cancer. There's a type of cancer we call pheochromocytoma. It's driven by that. You go in and that mass is removed. Your blood pressure will settle. Now imagine you had subjected yourself to over-the-counter medication for all your life for things that can be treated and corrected. Or your pressure is driven by cholesterol that is high. So one day you take a drug, it lowers your pressure, but you're not addressing the ongoing risk factor of this cholesterol that is depositing in your vessels and clogging. So you come down with a complication, but you're coming down with that because you're taking drugs over the counter and you're not necessarily getting worked up. By worked up, I mean getting investigated in terms of labs and followed up appropriately, and drugs being individualized for you. So I discourage over the counter. Well, in times of emergency, maybe you may be given a pill and told, go see your doctor. Please do that. Go see your doctor, go to the healthcare provider, and they will guide you appropriately. Yes.
There has been an increasing debate between these herbals and especially home remedies like the garlics, the cardamom and all that, and the prescribed medicine from the hospital. Would you discourage someone completely from using these home remedies?
I usually don't discourage the home remedies because most of it is especially dietary factors. But I do have challenges with home remedies sometimes. And one of the obvious challenges I face is the dosage. For example, if I tell you take ginger lemon honey, how much of that do I tell you to take? Is it 3 cups, 10 cups, 20 cups, every 10 minutes, every 15 minutes? Because this kind of dosage has not been standardized. So I tell you to take cardamom. Is it a sack of cardamom? Is it 1 scoop? Is it 3 cups? Yes. And we all know that everything taken in excess is poisonous. Okay? So you find people coming now, like especially the herbal remedy, because sometimes you just go, someone grinds a few things and tells you, this concoction will sort you out. Natural
juices, we see them. They're really mushrooming at a rapid rate in the cities and the estates.
Exactly, yeah. So those ones we are seeing now, people coming in with acute liver failure, and you can only trace it back to the remedies they are taking at home, okay, to the concoctions they are taking. So anything dietary, I encourage people to take it within the dietary portions. For example, rosemary is just known to be a spice. You cannot take a whole bucket of rosemary and then you say, I'll take rosemary like the way it takes kumawiki or cabbage. You know, that thing will mess you up. But if you just took 1 stick of rosemary and added it to your tea, it will have some taste. And it's a spice. That's what it's meant to be. The challenges with these concoctions is the dosages. The other thing I want to caution the viewers is that some of these so-called herbalists, they also take active ingredients of the regular drugs. They grind it together with the herbs, and they keep making money out of you. So my advice is that consult with your doctor. Try to take something in its natural form. If it's rosemary that you are taking, go and get it in that rosemary leaf and just have it yourself. If you decide that you're going to do tangawizi, go and get that ginger and just, you be the one to have it. The ginger yourself, grind it and do it, because our society now, those things are not regulated. And as we know how a good number of Kenyans behave, not all, they are likely to do things that favor their business.
Absolutely. Yes. And our time is almost up, but briefly, for someone who wants to monitor their blood pressure at home, what should they know about using home blood pressure monitors, and how reliable are they compared to the hospital readings?
Yes, thank you. That's a very good question, and it's also a good point as we draw to the end. I talked about the numbers. Now, the monitors that we have, there are some that you can tie to the wrist, around the place where you tie your watch, or the arm just above the elbow. Okay? So, because this is technology, you need to get a machine from a pharmacy that is already a calibrated machine to use at home. Okay? Don't just get any machine and use. Now, the ones that you put on the arm above the elbow tend to be more sensitive, as in more accurate, than the ones you put around the wrist. Like, nowadays we have the watches.
Yes, the wristwatch.
The wristwatch, you say it gives you your blood pressure. Most times they tend to be less accurate than what you get on the wrist. Okay? So in terms of practical advice that I give people is that if you have a home blood pressure monitor, okay, in a week, let's say you are recording 4 readings, decide that you'll do 3 from home and 1 from maybe a facility near you or a pharmacy near you, and then see whether they tally. If constantly what your machine is giving you is way lower than what you get from the facility, perhaps the next thing you need to do is carry that machine with you to the facility. Like in our clinic in Westlands, we encourage that and we allow that a lot. Come with your machine and allow it to sit there. The nurse will guide you on the technique, you'll measure it, and then we'll also measure you with ours, and we'll see whether it's giving you the same readings. Number 2, recording your blood pressure is not just something that you can do anyhow. So we tell people that sit, be calm for 5 to 10 minutes, okay? Let your arm be at the same level or near the level of your chest when it's being measured. Ensure your legs are not crossed, or you're not raised, or you're not receiving a phone call.
Or you're not laying on your back relaxing.
Exactly. So sit still. Then for the duration the machine is recording your pressure, do not talk, do not drink, just breathe normally. Okay, that reading is likely to be accurate because it's taken in the correct way. So back to your advice about home monitoring, I encourage people at least once or twice compare your readings with the readings of a facility machine. Where you are really in doubt, carry your machine with you. Let it measure you, and let also the healthcare provider measure with the standard machine and see if it tallies. If it doesn't tally, perhaps it's time to change that machine and get the accurate one. Yes.
Thank you very much. And as your parting shots, please share with us how unique are your services at Mata Hospital, and your parting shot advice to our viewer regarding this silent killer, high blood pressure.
Thank you. So, as you mentioned, high blood pressure is extremely common. So it affects 1 in 3 people above the age of 40, but now our shift is that even people below the age of 40, in your 20s and 30s, the prevalence has really gone up. So 1 in 3. So anytime you sit in a dinner table, think, how many are you there? You're 5. 2 of you are likely to have high blood pressure. And it has no symptoms most of the time. By the time you're having symptoms, maybe it's very late or the pressure is very high. High blood pressure leads to complications. And you can think about your body from head to toe. You can get a stroke, you can lose your vision, you can get a heart attack or heart failure, your kidneys can fail. So in that sense, then it's contributing to almost 30% of the deaths. 3 out of 10 people will die of high blood pressure. 10 million people will die because of high blood pressure that was not treated. Yet, it's a very simple disease to diagnose. You can just walk in, 2 minutes, your pressure is checked, and you're told if it's high or not, and how you need to monitor. Secondly, you can get drugs that can prevent all these complications, and you can live a whole life to 100 years plus. So you can get right drugs. And if you need to just get more and identify the cause and the underlying thing, we encourage you to come to our clinic. We are in Westlands Mall. We have an executive clinic, that we help people who have high blood pressure, diabetes, and other illnesses. So Mata Hospital has an executive clinic in 2nd floor of Westlands Mall. We have services every day of the week. We have all things inclusive, including a nutritionist to work with you in terms of diet and lifestyle. Remember, we did say that lifestyle contributes a very big part in driving the high blood pressure. Your services will be offered very quickly. Then you have follow-up visits that we can support you. We also give you support over the phone. Yes, thank you.
Thank you very much, Dr. Stephen Thigu, for your time and for helping us understand, demystify this condition, which is a silent killer, but of course a serious condition. We really appreciate your time. Thank you for walking with us through this conversation, Health Discourse Show.
Thank you, Elizabeth, and thank you, viewers, and welcome to our facility.
Great. Now, of course, our time is against us. As you have heard today, the good news is that high blood pressure is preventable and manageable when detected early, and when you commit to healthier lifestyles, you can stay free of high blood pressure or hypertension. A simple blood pressure check could save your life, could save you from any other conditions, severe conditions that might emerge because of that. And of course, we appreciate the fact that you've been with us since we started. It is time to close our discourse here. And of course, this edition has been quite interesting. Thank you for tuning in. If you missed any part of this conversation, feel free to catch the full discussion on our digital platforms on YouTube and Facebook. I am Asasha Elizabeth, and of course with my team that has been working behind the scenes indomitably to ensure that we come to you in a swift and best way possible. I appreciate Kevin Kitavi, Sister Rufina Jebchumba, Alan Andiver, and Ndenya Joffrey. And of course, I've been your captain, Sasha Elizabeth. Until next time, take care of your health, because definitely it is your greatest wealth that you'll ever have.
In a world where health information is everywhere, but clarity is rare, there's a place where understanding begins. Welcome to the Health Discourse Show, a weekly health talk show bringing you informed, practical, and engaging discussions on the issues that matter most to your well-being. From lifestyle diseases and cardiac health to nutrition, mental wellness, preventive care, and the everyday choices that shape healthy living. Here, we don't just talk about health. We break it down, ask the right questions, and give you knowledge that you can actually use. Because good health starts with understanding and healing begins with conversation. Tune in to the Health Discourse Show with your host Asasha Elizabeth every Monday from 9:30 a.m. to 10:30 a.m. for informed conversations that heal.